everybody, welcome back to my channel. Today, I'm very glad that we have Jennifer Krafft who are joining us from Mississippi. So Jennifer is an assistant professor at the psychology department at Mississippi State University. Jennifer is here with us because her specific research interest is on hoarding and especially self-help based on acceptance and commitment therapy approach for hoarding. So I'm very curious and excited to hear more about this approach, Jennifer. So would you like to share anything about you that I haven't already talked about with our audience first?
I think that covered it very nicely. Thank you.
Super, super. Yeah. So would you like to share, like, how did you come to find yourself in the research topic of hoarding and especially acceptance and commitment therapy?
Yeah, hoarding is something that I had a pretty long-standing interest in. I think from knowing some people in my life who had problems related to clutter, and also just being interested to see how differently we all relate to our belongings. There is so much variability in kind of the degree that people of attachment that people feel to their belongings and how we think about our belongings, how we make decisions about our belongings. And then as I started to get interested in a career in clinical psychology, I was really just struck by the degree to which hoarding is a really relatively common problem. And it's so undertreated, under-resourced. The options for it feel to me very limited compared to other types of conditions or problems that are equally common. Even within the field of psychology, I still kind of hear people react to hoarding as if it were a niche thing, but it's really not. It's really relatively common, as you know. And so I became really passionate about trying to develop treatments and try out different strategies to meet that kind of unmet need for hoarding care, which was also part of the drive to do self-help work, where hopefully our interventions can be, we can develop an intervention that can be accessed by a large number of people, that is scalable, that a lot of people can reach at once and use on their own time, or use even if there isn't maybe care locally for them that would be a good fit in terms of hoarding treatment.
Yeah, that's so beautiful because it's so needed. And I really echo with what you're saying that like even in the mental health field, clinicians feel like, oh yeah, hoarding is this thing that only happens to a small percentage of people. That's such a misunderstanding because it's twice as much as OCD. Yeah, and so yeah, if we know so much about OCD, but we know so little about hoarding, that's just not right.
Yeah, absolutely.
Right, yeah. So I'm very curious to hear more about the ACT approach as well as the self-help modality. Yeah, because like you said, it's so under-resourced. And a lot of times we have folks saying, well, I want to get treatment for hoarding, but I can't find a local therapist who are trained or specializing in this area. So I think there's indeed a lot of need for self-help resources. Yeah, so would you like to tell us, whichever one you want to share first, tell us more about what this act for hoarding entails and how do we use it in self-help kind of format?
Yeah, absolutely. So, I don't know how much folks listening to this might be familiar with ACT, but ACT is a like modern form of psychotherapy that focuses on helping people live lives that are more consistent with what they really care about by teaching skills of mindfulness, being able to bring your mind more into the present moment, of recognizing your mind at work, noticing the ways that your mind kind of tells you stories, the way your mind is constantly reacting and evaluating and making judgments and generating rules for you. So the process of noticing your mind at work, connecting with what really matters to you most, connecting with your values that you care about most, identifying the things that really mean a lot to you, that make life worthwhile to you. And taking steps towards that path, sort of actively engaging in behaviors that bring you closer to the life that you want. Acceptance and commitment therapy is a treatment that is used for a lot of different conditions. So there's good evidence that it's useful in helping people overcome issues of depression, anxiety disorders, OCD, some things that might surprise folks like psychosis as well. So ACT gets applied very broadly. And yeah, one of the things that's cool about it is that we have lots of good evidence that these kind of core psychological skills of ACT, of increasing what we call people's psychological flexibility, helping people be more mindful, more connected with what they really care about, more in the present moment, that those are skills that we can teach through self-help. So when I was in my graduate training, I worked in a lab where we developed and tested lots of different kinds of self-help treatments using ACT, including both like mobile apps, targeting more sort of in the moment, things that people might be struggling with, and like self-help websites that would really kind of walk you through step by step, how do you apply different parts of ACT in your life. And found that overall people do seem to get a lot out of them. They have some limitations compared to therapy, but they also have a lot of benefits, and they can be easier for folks to access. So yeah, over time I've developed more of those kind of self-help resources specifically targeted towards hoarding and applying those skills to hoarding and to clutter specifically.
That's wonderful. Yeah. So if I may kind of like ask you and invite you to dive into the meat a little bit more for us. So I would imagine, judging based on the name, acceptance and commitment therapy, right? So what does acceptance look like in the context of hoarding, and what are some of the skills that are facilitating that part? And similarly, how does commitment look like in the context of hoarding, and what are the skills that people can learn from practicing?
So I think the kind of core insight of ACT that I think about in hoarding is that it's really helpful to notice the ways in which our mind is constantly at work, generating thoughts, judging the world. And our mind tells us a lot of stories. And then like in hoarding, some of those kind of stories, evaluations that we might hear a lot of are stories about belongings, the significance of belongings, like what it would mean, how distressing it would be to let go of a belonging, how difficult it would be to make decisions about belongings, beliefs about the connection between our belongings and ourselves, that I'm a creative person, and so I need to have like a certain amount of craft supplies or things like that, that those are important to my identity. And some of that ties into the emotions that we feel, like leads to when we really like buy into those stories, when those stories, those ideas that our mind have are like everything we can see are right in front of us, it becomes very emotionally difficult to discard belongings. And so the first, like on that acceptance side, I think the first piece is noticing that those stories are happening. That doesn't mean getting rid of them, but it means like noticing, okay, my mind is at work right now. My mind is really busy. My mind has a lot to say about this. Noticing that process, stepping back from it a little bit, and then allowing the experiences, kind of mindfully allowing the emotions that come up with making decisions and with discarding belongings. So acceptance, we're talking about acceptance of the thoughts and emotions that come up around discarding and just making different choices in general, making different decisions. So engaging in increasing your openness to experience those emotions and thoughts that come up, noticing them for exactly what they are, and not so much for what your mind tells you they are, or tells you about them. So that's kind of the acceptance side.
That's great. So while you're speaking, I'm thinking about how this is similar and different from what most people know about the most, which is cognitive behavioral therapy.
Yeah.
So in this CBT model, it's not the similarity here is to identify the thoughts that are in your mind about the belongings. But I think that I'm hearing the difference here is that as opposed to labeling it as something that's unhelpful and wanting to replace it with a different kind of thoughts, act as a more kind of like spacious approach to kind of like, yes, noted, this is going on in my mind, and noted, these are the emotions that are also arising, kind of dancing with the thoughts, and they're all there. And so the acceptance part is not to, I guess it's not about, okay, these are bad, I need to get rid of them, or I need to change them, but I need to just know, hold space for this is what's going on here.
Yeah.
Getting it right.
That's exactly it, right? I think one of the phrases that stuck with me most is like, what if even your hardest thoughts don't have to be your enemy?
Hmm.
What if kind of instead of treating your thoughts or uncomfortable emotions as an enemy, what if you could kind of invite them along, maybe in your passenger seat if you were driving, invite them to be along for the ride, allow them to be with you for the ride. And I do think that is something that is a bit distinct about this approach compared to other things that people might hear about that focus more on changing your thoughts or changing your emotions.
Right, right. That makes sense. And I would imagine some people here, especially a lot of times, folks have like wanted to do something more active, right? So think
Mm.
a lot of times we have kind of people ask, what's the difference between acceptance and giving up, or
Yeah,
acceptance and enabling, right? So
yeah.
I think this is the kind of things that people are listening to this may be asking, right? Would you say more about it?
Yeah, absolutely. So I think it's an important distinction. It's a great question. So when I talk about acceptance and the way we use acceptance and commitment therapy, we're talking about those internal experiences, acceptance of our thoughts and feelings, not accepting the situation as it is, not accepting our behavior as it is. So it's bringing together accepting the thoughts and emotions that come along for the ride with changing our behavior to make it more consistent with what we really care about.
Mm.
So accepting the emotions, accepting the thoughts, and changing our actions to be more consistent with what we really care about. So, for example, I think a lot about like my own values related to parenting. So I have a 3-year-old. It's wonderful, and sometimes there are moments where I feel very frustrated or tired, and um, I find it really helpful to accept and allow, okay, right now I'm feeling frustrated, right now I'm feeling tired, and to still work on making my behavior, even with that emotion along for the ride, making sure that even when I am frustrated, I'm tired, that my behavior is in line with the kind of parent I want to be. That when I notice myself starting to get frustrated, I try to come back to being present with my kid very imperfectly. I often have to keep coming back to that over and over, but I try to keep coming back to what kind of action do I want to take, allowing the emotion and not necessarily acting in a frustrated way, but acting in a way that's more consistent with the parent I want to be.
That's great. And I think that kind of like is tied into the commitment part,
Yeah,
right? Yeah.
absolutely. So on the commitment side, I think one of the really important pieces there is thinking about that piece of connecting with what matters to you and how that relates to your belongings. So values, as we talk about them in ACT, are like what matters most to you, the things that matter most to you, the things that would make life meaningful in terms of how you want to act, how you want to show up in the world, what you want to stand for. So they're different from goals. They're not something that you can be done with, just like being a caring parent isn't something I can check off my list and be done with. And they have to be like, it's most useful when there's something that is means so much to you that it's not really about the outcome. So values are the things that like mean enough to us that even if me being a present parent doesn't lead my kid to be happy on that day, even if she's still grouchy and distracted and all over the place, I still care about being a present parent, even if maybe it doesn't lead to any particular outcome. So values are those kinds of things, like the things that really matter most to you in terms of how you want to act and show up in the world, and that are so meaningful that they can kind of dignify hard work, that they are kind of an end in and of themselves. So often people's values can be anything. There's no right or wrong values, but might have to do with things like, the way that you show up in relationships, wanting to be caring or open or reliable or faithful or creative, all sorts of different values that people might hold. And I think values are really important in hoarding, in part because values provide us with sort of a positive, consistent source of motivation. Often when people are kind of aware, like I've got this problem with clutter and I have to work on it, it really is driven like those behave like that attempt to work on it, those goals, they're really driven by this kind of like rigid sense of like, I have to, I've got to, I should do something about this. Other people want me to do something about this. They're kind of driven by people feeling a sense of obligation. And that doesn't tend to doesn't tend to make it very rewarding to actually try to declutter. And it's a hard process. It's a hard thing to do. Like we were talking about, it involves kind of facing some difficult thoughts and emotions. So I think values are really critical, and that your, values, like identifying values that are related to decluttering, that like dignifies the work, makes it worth doing, and can really like guide people towards figuring out what path is going to work best for them. So, so identifying values is a really essential piece, and then developing actions that are more consistent with that values. Oh yeah, so one thing that I really like to emphasize in this world, if I'm like working with somebody doing ACT for hoarding or in self-help, is that it's not so much centered on, or the thing I care about most isn't like what are you getting rid of and how much are you getting rid of. It's what are you making space for in your life? What would you like to have more space to do? What would you like to be fostering by making these changes? And what kind of changes would you need for that to happen? So if you want to be more creative, you want to actually be able to use your craft supplies, what changes would need to happen for you to be able to do that thing that is really meaningful to you?
Right. That really resonates with yeah, that really resonates with me, because while you're thinking of talking about this different kind of values, I do think about, yes, a lot of people come to therapy room and then they say, well, my goal for therapy is to get rid of my stuff. Yeah. And oftentimes I ask them, why do you want to get rid of your stuff? Especially if you live by yourself and you seem like you are used to this. Why? What makes you want to get rid of your stuff? Like you said, oftentimes people would come up with these more like external kind of motivation, like because this is not normal, this is not how a normal person should live, because I feel embarrassed, because my family member threatened me or my landlord's on my back, right? So there's these kind of reasons, right? And I really hope that sometimes in the work of therapy, we really hope that we can find intrinsic values, intrinsic motivations for people, and especially like coming from a CFT, compassion focused therapy background. I feel like the definition of compassion, the first part is being sensitive to our suffering. So maybe we our value can derive from, I'm noticing I'm really suffering. My quality of life is really like affected in a negative way by the amount of stuff that I have. And I'm noticing that I'm holding on to stuff actually because of some emotional suffering that I have. Maybe fear, maybe not having control, or like getting comfort from my belongings. So if I am sensitive to this and I really want to heal this coming from a self-love and self-compassion kind of place, and hopefully that kind of ties with what you're talking about, the value, right? Could there be some kind of things that they want to bring into their life? Like you said, I'm a creative person. My value is to be able to be creatively expressing myself. And maybe in order to facilitate that to happen, creating space in my home is part of it. But that's not the only thing. It's almost like the goals in therapy with hoarding in this kind of approach would be more holistic. It's not just tunnel vision about how many things you got rid of today.
Absolutely. Yeah. If that was the only thing we accomplished and somebody wasn't actually leading a life that's closer to, that brings them more meaning, that brings them more vitality, yeah, it would feel like we hadn't done our work, definitely.
Yeah. What would be the point? Just to send it
Yeah.
to your neighbors.
Yeah. Yeah.
Would you be able to share a little bit more about any kind of existing self-help resources, or any kind of like upcoming resources that you're developing, or research that you are like you're cooking right now?
Awesome. Yeah, I'd love to talk about that. So one major thing that I wanted to mention is in a study that I conducted a couple of years ago, we developed an ACT self-help website for folks with, hoarding or significant clutter problems that addresses all of those different pieces of acceptance and mindfulness and connecting with your values and putting that into action. And we found in the study that we did that seemed to be pretty beneficial to folks overall. And we actually, in partnership with my collaborators at Utah State University, they made a public version of that website available. There is a cost, but it's a fairly low cost. And it's, I think, so that's a resource that if this resonates with folks, if this sounds like an approach that you might get something out of or be interested in, I would definitely encourage folks to check that out. And I'll send a link that you can share. It's called ACT Guide for Decluttering, ACT Guide for Decluttering.
That's
Yeah.
great. How many
Yeah.
how many sessions is that, or how long is the overall course?
Yeah, so the course it's split up into 16 sessions, and each session is meant to take about 15 to 20 minutes each, and then to sort of practice some things, practice trying out those skills in between sessions. So the idea that we had was for folks to typically do about 2 of those sessions a week. So do 2 fairly brief sessions, maybe twice a week for 8 weeks. But it is definitely, it's self-paced, self-guided. So it is, up to folks to decide how and when they want to use it.
That's great. That's great.
Yeah.
Maybe I'm thinking ahead, but I'm just wondering, I'm just thinking about how cool would it be if there would be almost like a community of people who are using this, and then they even have a forum that they can support each other, communicating which step are you at right now, or I'm experiencing this, what's your experience? That would be so cool. I don't know if this already exists or this is something that could be thinking about, could be developed in the future.
That would be amazing. We don't have anything like that currently, but yeah, that's definitely, I would love to try that out in the future.
Lovely.
Yeah. Yeah, and then I'm also currently running a study where we're testing out the impact of writing exercises where people either engage in like values, writing about their values, or engage in sort of broader self-reflective writing, self-reflecting on, related to themselves, their belongings, their decision-making process. So there's information about that study at my lab website. And I'd love it if people check that out as well.
Sounds great. We'll include both in the comment below.
Fantastic.
Well, thank you so much again for joining me and
It
sharing
was
your.
my pleasure.
Oh, great. Yeah. Well, we'll put the links below and we hope to chat with you again soon. Before we end, is there anything that you would like to share that we haven't covered yet, or something just come up in your mind that you just want to spontaneously say to people who are watching this? We mostly probably have people who experience hoarding who is watching this and their family members. And I think we also have some professionals that are watching this.
That's a great question. I think I would really just want to give my encouragement that this is a challenging issue, and people who are struggling with it are really, really far from alone. And I hope that some of the things that I mentioned might resonate or be helpful for folks to think about. Yeah, when folks are really kind of stuck with hoarding and clutter, it can be a really challenging situation. And I think that there is hope. I think that especially these aspects, I mean, I really, really admire your work in compassion-focused therapy too. And I think that these aspects of connecting with what you care about most, connecting with your values, kind of cultivating a sense of self that is based around what you care about and compassion towards yourself rather than self-criticism, rather than being defined by everything that your mind says about you. I think those things hold a lot of promise. I'm really hopeful for what they can do for folks. I really the other thing I would say, like, I really try to practice what I preach. And I know for myself that like the work I have put into accepting difficult feelings or accepting difficult thoughts, recognizing them for what they are, that work has paid off for me in a way that trying to control them or stop them or make my thoughts and feelings be different didn't pay off for me. So I'm speaking a bit from my own experience there as well.
I really appreciate that. Yeah, yeah. As you're speaking, I'm feeling like yes, there are not only there are so many people who are experiencing hoarding issues, and most times we don't talk to people about it, so it can feel like such a secret, such a lonely process when there's in fact a lot of people struggle with the same thing. Yeah, and similarly, not like even for people who don't necessarily experience hoarding themselves, self-criticism or things that are harsh that we say to ourselves or things that are not true that we tell ourselves, these things, I think it's universal. It's universal. I think that probably 99.9% of the human on earth suffer with this, right? So it's just so much. It's so great to hear that you are putting your like life's worth of work on this area, and then sharing what kind of coming from like you want to help, and sharing what works for you with folks out there. Yeah, so I'm just really moved and being like, this is so beautiful. We are like a community here.
Thank you so much. Yeah, I think I couldn't agree more about that importance of sort of connecting with other folks who are on the same path, and that it can be easy to feel isolated, and there really is, yeah, these really, like, a lot of these things are universal human experiences.